Hi, everyone. Today we have another co-author spotlight of the book, How Healers Heal. We have Dr. Julia Huber with us today. I'm so excited. Hi, Julia.
I
Dr. Huber and I were co-study mates for our lifestyle medicine board, so we know each other well. And now she's sharing her incredibly powerful story in this book for us. I want you all to check out her story, but let's get to know Dr. Huber a little bit better. Tell us a little bit about yourself.
I actually live in Kentucky now and have been here for probably the past 25 years of my life, but I'm originally from Virginia and grew up on a small kind of gentleman's farm, some people might call it, outside of Charlottesville, Virginia. My parents raised sheep and sheepdogs, and they had honey in beehives and a really huge organic garden. And that was probably my introduction to just healthy living and healthy eating, although I probably didn't, I can tell you, I didn't appreciate it quite so much at the time. It was also a good introduction to the practice of medicine. Because I used to help my dad with the lambs. The first surgery I ever did was cutting lambs' tails off. I don't think I could do that now. I think it would be extremely upsetting to me. And the first um, gynecological exam I ever did was on a mama sheep whose lamb was stuck. So that's part of my back is part of my background, and it's very much inside me. I ended up in residency at the University of Kentucky, and this was in 1996, and really enjoyed my rural rotations. I absolutely loved them. And I can't say that I was in the majority, I was probably in the minority, but they made me think of the people I knew from home, people who are just working the land and living their lives. And I noticed in the places where I rotated as a resident, as a moonlighter, that I really was interested in what people were growing harvest wise, growing in their gardens. And that interested me a lot more than other conversations at other facilities. So I ended up working in rural emergency departments for way over 20 years. And sometimes it was a little dicey getting to work, going past farms and areas where there was no internet and still having to get to work. But I loved the sense of community. I really enjoyed working in the community hospital setting and really seeing how staff pulled together for one another and for their patients. So that's, I think, a really important part of who I am and how I practice medicine and how I also function as a coach. I really believe in this sense of community and sense of connection and sense of togetherness in terms of keeping one another healthy.
I'm going to summarize a little bit. So you're an actively practicing ER physician as well as a health coach. Tell us a little bit more about that, and then tell us how you got introduced to the field of lifestyle medicine.
Yes, I just want to clarify a little bit. I actually do occupational medicine on telemedicine now, and I use my ER doctor hat for that. And in between times, I also function as a coach. I certified with the International Coaches Federation, I think around 2009, 2010, and have been coaching since then. And I also received further training as a trauma informed professional coach, which is a program uh, created by a pediatrician who saw the need. And I've done that also for the past 2 years. And that's a real strong area of focus for me, as I've seen, particularly during the time of the pandemic, how trauma is very universal. No one can escape it. And if we're going to move forward from it together, then we need to return to the community and to that level of connectedness and really to a more holistic sense of looking at our health. And that's not something that really emergency medicine lends itself to by default. Um, I know, and I talked about this in my paper, that I was seeing kind of the final endpoint in the ER. The people who've been, either they got hit with bad genes, and so
Don't
they
give away your chapter.
uh,
I love your chapter. Don't give it
yeah,
away.
oh no, but
Um,
saying that, no, I'm just saying that there's some people who maybe by by family history or by, as we know this as lifestyle physicians, by their habits, end up, end up in the ER. That's not blowing my story. That's just that's how a lot of people end up in the ER. Sometimes by accident, sometimes it's because of the genes they inherited, and sometimes it's by lifestyle choices. So it's very satisfying to me to be working on the other end of things and really trying to help keep people out of the ER and help keep them out of the regular doctor's office.
Thank you for that. I mean, you're such an eloquent writer as well as a speaker. So I just want people to enjoy your story and the way you've written it. But you're right. We need people like you who are taking medicine and kind of making it a more holistic approach, like you're doing with all of the combined trainings that you have, and applying it to each individual person to help them get to their next best self. Can you remember how, I know lifestyle medicine's been a part of your life, your whole life, but not in a formal sense. How did you get introduced to the formal field?
I'm trying to think back, and the only thing I can remember is that I came across it, I hate to say it, but on Facebook, on social media, because a number of physicians were talking about lifestyle medicine. And I thought, this sounds really interesting. And I started looking at other people's websites, and I thought, these are some amazing physicians. They are really at the forefront of what it is to be healthy. And I looked at the website for the American College of Lifestyle Medicine, and everything kind of came together. I think that we are taught some wellness, and I think that medicine is evolving very, very rapidly. But at the same time, lifestyle medicine has everything wrapped up in a really beautiful package. And what I really appreciated is, again, that aspect of connectivity with other people, as well as the approach to looking at, they call it risky substances, but I kind of stretch that a little bit further, and I look at really the environment being a risky substance. And I stretch that personally and professionally into looking at situations that we're in as being risky substances. For example, the workplace. And that brings me to kind of full circle to physician wellness, which is kind of a pet interest of mine. I think that in order for us as physicians to really be available and really be present to our patients, we also need to work on ourselves. And right now, the level of burnout and stress is just unparalleled. And so I think we really need to work on pulling all of these little threads together and weave them, and have it be a little bit less about us and them, and have it be more about all of us being present together and moving forward in health.
Yeah.
That brings me to another topic, which is what is so incredible about our book, because it's the opportunity for physicians to bridge that divide between physician and patient and really reveal our human side, which I think sometimes patients really can't see, or maybe we don't reveal it, or maybe both. And here's an opportunity to kind of get an inside look at some of the struggles that we have had as physicians, as maybe medical students, as mothers, as fathers, spouses, and everything in between. And I love that we have the opportunity to tell our stories. I think that when I've talked with a number of our colleagues who have written these pieces, it's been really challenging, because a lot of, I think some of the very vulnerable parts of us have been opened up. I think this is a unique opportunity to really see that. And that allows us as patients also to kind of engage a little bit, and see what the opportunities are for us to be vulnerable. And that really comes full circle back to this common theme that I'm really kind of bringing home, of connecting. What I've learned in the trauma informed work that I'm doing is that the more that we can connect, the more we can heal from our traumas. And one of the ways that we can connect is by speaking to one another, as you and I are doing now, and also by the written word, which is very, very powerful. And so now you've got this beautiful compendium of the written word, of these just very vulnerable, very tender um, gifts that physicians are offering. So it's an opportunity to open that window and step in carefully and get a deeper understanding of where we see healthcare going in a wonderful way. I think there's a lot of negativity right now, and as things are shifting in society, and certainly uh, having to survive a pandemic underscored some of the undersides of that. And meanwhile, lifestyle medicine is just forging forward, really with full tilt, with a lot of hope, with a lot of global and community open mindedness. And I think this is where we need to put our focus, so that we can bring healthier communities together.
Wow. I love a lot of what you said. You talked about the environment being a toxic substance. I
Mhm.
think that is so true. Physician burnout, physician wellness, connectivity, and how we can use all of that to kind of create this wholeness of community as well as self. And
Mhm.
I can't put it more eloquently than what you put it.
It's
Thank you.
exciting stuff. You know, the way I look at it is people think about a diet. And so our diet is really, we're feeding one another, right? We're feeding one another hope. We're feeding one another vision. We're feeding one another wellness. And that's part of our diet, if you wish. I think a lot of people think of healthiness as just kind of, eating your brand cereal or something like that. And this just kind of blows that completely open. We're at a different level now, and it's really exciting to be part of this.
Oh my gosh, I'm gonna have to put that in the book somehow as a quote from you to write that down.
Aw.
I love
I'm
that.
just
So,
excited about it. I just love it. It's the vision behind this is really exciting. And I think it's going to bring us forward so much more quickly.
well, thank you for being part of the book. Do you have
Thank you.
your number one takeaway for self-care in addition to all the wonderful nuggets you've shared with us today? And then how can people connect with you? How can they follow you? And anything else you want to mention?
Sure. I think that particularly in the post-pandemic world, a lot of us are struggling with our health, and a lot of us are struggling with our inner wellness. And I think it's helpful for us to remember that trauma is universal. And also, when we have encounters with people, just to assume that they may have had traumatic events, just assume they've had traumatic events in their lives, and take the opportunity to listen very, very deeply, very, very deeply, because we need that right now. I think a lot of our ideas of wellness are often externally driven. And I think that if we hold still long enough to listen to one another, we can hear the parts of it that are internally driven. And that's the exciting thing for me about coaching with people, is that we can connect at that level. And that's where you can see more permanent change happening. So rather than being kind of a victim of another diet, you can actually kind of shift your inner world so that you can more spontaneously make healthy choices that reflect um, that level of self-respect and mutual respect for others. Yeah. So in terms of contacting me, I've got a website. It's really easy. It's juliamariehubertmd.com. So if you want to connect that way, there's a really easy way to sign up for just a free 25-minute conversation with me, where you can ask me any questions one-on-one in a very private setting. Because a lot of times people have sensitive things they want to talk about, and I'm happy to sit down and love talking with people about that. And that gives them the opportunity to meet me in, face to face, sort of on a televideo setting, but also have a more intimate conversation, which I really welcome.
Well, thank you for everything you're doing. You're just like a shining light in the world all over, and helping patients with all of your education and certifications, and putting a really personal approach to all of it. Thank you
Oh,
for being
so
part of our book.
yeah, I'm really excited. Yeah, this is a wonderful
Yeah.
message.
Everyone check out Dr. Huber's chapter in How Healers Heal, and check out her website and connect with her. Thank you so much, Dr. Huber, for your time.
My pleasure. Yeah.